Good morning, my name is Vanessa Booysen. I'm a lactation consultant and neonatal nursing specialist, but I am passionate about breastfeeding. And during the first 1,000 days campaign, we are promoting breastfeeding. So the benefits of breastfeeding I have already discussed, and you can go and look for that snip to watch it again. But if we take the word breast, the second letter is R, and that is for right after birth. And you may be wondering why right after birth, because that is the opportune time for mother-baby bonding. This little baby is born, comes out of the mother's womb, and is placed skin to skin on the mother. And he looks around, and he sees his mother's beautiful face. And his brain just starts developing by smelling her, seeing her, tasting her. But also we learn to breastfeed right after birth because the baby is alert then. So if you look at the baby's sucking pattern, if this is the mother's breast, do you know that a baby doesn't suck milk out like his tongue rolls the milk out? So his tongue goes under the breast and does this. And that action is the milk removal action. So if we're going to put anything else before the mother's breast in this baby's mouth, we're going to cause nipple confusion. And anything else can be a dummy or a nipple shield. Please don't use a nipple shield, or a bottle. We're going to confuse this baby. So he learns to do it like this. And research has shown that immediate breastfeeding right after birth can absolutely benefit to such an extent that a mother can have 1 liter of milk per day more than a mother that only started breastfeeding 4, 5, or 6 hours later. So the right after birth is extremely important. And how to latch correctly. Please, we don't feed on the nipple. We feed on the areola. So if you're going to latch your baby too shallow, you're going to crack your nipple and the baby won't be able to remove the milk. So right after birth is extremely important, and that is why we don't want to separate mothers and babies. We don't want the baby to go to the nursery room to be there for a period of time. We want this wonderful bonding and attachment, because now we're not only giving nutrition, we are emotionally protecting the baby by hold me, feed me, and love.